Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have with us a very special guest, Lisa Miller. She is the CEO of VIE Healthcare Consulting. Lisa, welcome to the program.
Tom, thank you for having me on your program. Super excited to be here and have a discussion with you.
Awesome. You recently wrote an article on your website, viahealthcare.com, called 4 Ways Telehealth Can Improve Hospital Operations. Tell us a little bit about that article.
Absolutely. In the last several years, I've been doing a lot more thinking about how telehealth can really positively impact patient care. And there's probably a number of different ways, but I think these 4 areas encapsulate a lot. And it's reducing hospital readmissions. That's a challenge for hospitals, particularly for a lot of their pay-for-performance agreements, and even with Medicare, that the 30 days that they have to really keep those patients at home and not have them readmitted. But more importantly, you want to keep patients healthy and keep them on that road of recovery. So how it's used for readmissions is the follow-ups, the appointments, all those interventions along the way, the care that's needed. And it's really important, ensuring they're taking their medications. Any issues, remote monitoring, right? Are they checking the vitals? There's all different ways that interventions. And of course, we all have phones that we can, easily have an app and talk to a nurse or a physician assistant or a physician. So that's one. I have some personal experience. I take care of my mom, and I see how amazing it's been to care for the elderly, particularly in COVID, because so many of these calls or these appointments, instead of going into the office, we've been able to manage her care. She's a complex patient, and we've been able to maintain her health via, numerous different telehealth strategies with numerous different providers. And I think that's, if I'm a system, I'm looking at how do we care for the elderly and really keeping them well and using telehealth as part of that strategy. And I think there's other aspects, it's rehab care, mental health, second opinions. What a great way for patients to be able to use telehealth to get that second opinion. Insurance companies love second opinions. They promote it, they pay for it. And I think really importantly is the hospital's marketing and communication about how easy it is to use and to call and to, if you've got questions, but really promoting, the telehealth to patients in their communities.
It's part of the challenge in that health systems, large, small, and even ambulatory providers don't do enough in promoting the use of alternative access points to care, especially now with COVID and obviously the Delta variant of COVID.
Yeah, I think you absolutely nailed that. That's a critical component, that there's these different aspects that the hospitals need to build upon. I think, they've used telehealth to a certain degree pre-COVID, and maybe they've used it in the hospital for specialists. Like, if they're a rural hospital or they're not a specialized hospital, they're using telehealth to get in that specialization. And I think they've begun to use that. I mean, you know that better than any of us because with your background, right? I mean, you've built those networks, you've built that and work with health systems, so you know that how they've used that within the hospitals. But I think the gap and the importance of really taking an assessment, but that gap is where else can they use it? Where else can they have those points of entry? And how are they communicating it? And how are they training their employees? But I actually think that's the gap. You nailed it. They're not using it enough in different points of entry, and there's so many opportunities.
Yeah. So, you mentioned your mother, and I've been there with my mother and my father-in-law, and, we're experiencing the same thing with my mother-in-law, and even my father for that matter. So we all go through that, right, with our parents. And we know, and because of that experience, we know really the true challenges of surfing the healthcare system in the context of getting the right care and coordinating care. If my 83-year-old mother was able to do it on her own, I'm not quite sure, with all due respect to my mother, she would have been able to do that, right? It's just too complex. So there's challenges. So my audience knows exactly where I'm going to go with this. The average Medicare patient, 5 chronic conditions, sees 9 different doctors. They only spend 15 hours in front of their doctor in a given year. For me, the true question around care is what happens the other 8,745 hours? That's where your mom, my mom, really needs the assistance. It's not what happens when you're in front of the doctor. It's what happens when you're not in front of the doctors that's going to influence care the most. Thoughts on that and
Yeah,
how hospitals can help in that regard?
I love this conversation because I actually think it's probably its own book. It's certainly because I think, you've talked about essentially 4 parents that you're taking care of, and and I am in a similar environment now. But I'll take a step back. My mom fell last year in August. So it's been a year, and she had a really bad fall. She actually hit her face on the bathroom sink. She's fine. And she walked out of the hospital. It was amazing. Of course, she had some, stitches and so forth, but other than that, she's bruised up. But I will tell you that telehealth was allowed us, my sister and I, to care for our mother as, the caregiver. So I think, to answer your question, that telehealth helps the caregivers so much so, instead of us having to run to appointments, which we do, we have to go in and see, certain doctors face to face. But I'll tell you what, telehealth allowed us to care for our mother in such an amazing way, to check in with a nurse practitioner about her pain, or have home care, or have remote care. And I felt like she got such great care, and it supported us as the family. So this is, I think, ultimately where hospitals start needing to think about it. It's hard, as we are the sandwich generation, or whatever you'll call it. It's those caregivers have to make the appointments. Those caregivers have to do all that work. So how do you support the caregivers so they can really be that extension for the hospital to care for the patients? And I think that's the key.
So what do you think the inhibitors are when you talk about 4 ways healthcare can improve hospital operations? And then you have a similar article that talks about why hospitals need a telehealth strategy. What do you think some of the inhibitors are?
I think there's a couple of them. It's a great question. I think on a very tactical level, it's training, right? I think, we've got to deploy, and train employees and change the way we do things, right? So now we get into some of the bigger issues. It's change, it's now we have to change how we can't do things the way we've always done things. Right. And I think that's uncomfortable. And you almost have to stop and think, wait a minute, is this an entry point? Like you said, is this an entry point where we can infuse telehealth? But people just do what they normally do. And then as everybody knows, there's so much going on with now the Delta variant, and they're so overburdened, and there's so many things to do as is. Now you're going to layer in something else. But I think there really has to be a communication and a vision that's given, really a strategy, and maybe take baby steps. But I just think there's just so much going on for healthcare workers to add something else. But I think in the long run, it will help them.
I agree. If you're just tuning in, you're listening to The Virtual Shift. I'm your host, Tom Foley, and today we're speaking with Lisa Miller, CEO of VIE Healthcare Consulting. We're talking about hospitals and 4 ways they could improve hospital operations through the use of telehealth. So you mentioned earlier remote patient monitoring. And to me, when I hear the word telehealth, I often think that it is misdefined because in COVID times, 18 months ago, health systems just did whatever they had to do to maximize access between them and their patients. And it was the right thing to do, right? But they went to the Zooms of the world. They went to video aspects of the implementation. A lot of the major EHRs, which influence hospitals, went to integrating video. But to me, that's only one of many modalities of care, right? So video, I think the stats say that, I don't recall it off the top of my head, so I'll have to go back and get my facts checked, but somewhere in the neighborhood of 33% of telehealth encounters were audio, and another 30 some percent was in video. But I look at virtual care as more the norm. And you mentioned earlier telehealth, remote patient monitoring, you implied chronic care management, right? And you talked about medication adherence. So that leads into the remote therapeutic monitoring that CMS just promoted. So to me, that is the continuum of virtual care, right? It's all of that. So it's when you talk, so, and it has to be integrated into the fabric of care delivery in order for it to be maximized by its community, the patients, obviously. So, and to me, remote patient monitoring is part of the answer to what happens the other 8,745 hours, right? I can give my patient a medical device. I can monitor them, whether it's one medical device or many, depending on their comorbidities. I can do a very adequate job, a very, not adequate, but a very good job of measuring them throughout the month and engaging them on a path to wellness. Your thoughts on that?
I actually think it's a missed opportunity. I agree with you. I think right away people think about telehealth as video. I think you have the stats, so I think people just go to video. They think video, but I think the calls could easily be done. Like in the case of our parents, you're right. Setting up that video is not easy for them, but they could take a call, and that's a telehealth visit. But the missed opportunity in a big way, which I really pre-COVID was really talking to a lot of my hospitals about, is this ability to monitor in real time. Remote patient monitoring is such a tremendous way to care for particularly patients that have, like, whether it's chronic conditions or the elderly, because you can see things and trends as they're happening. And I often remember conversations with a nurse practitioner. My mom does get monitored, and catching such slight nuances on their way to becoming a big issue. And it's just, there's so much wisdom in that. And I actually think whether it's blood pressure, the other ways that you can monitor, like you said, there's so many different ways, even if you have a cardiac monitoring. But I would have my complex patients really set up in such a way that I would be looking at them remotely and really watching the different, ways that, would indicate there's something that may be going wrong. Pick up a call, maybe, whether it could be something as simple as they haven't eaten, and it's a reminder. It may seem so simple, but that can have, second order consequences. So I think hospitals really need to look at this remote patient monitoring. I think it's such a huge opportunity for care, and really just catching things before they become an ER visit.
Well, it goes back to your point of reducing hospital readmittance, ED visits, and things of that nature. If we do, because it is covered, and nothing happens in healthcare unless there's a CPT code, right? So it is covered. And the idea that a doctor thinks that, hey, I don't have time to, I'm already, I have a loaded patient base. I don't have time or the resources to monitor these alerts, right? We talked about alert fatigue. We didn't talk about it, but you hear about alert fatigue and things of that nature. But a remote patient monitoring platform really takes that off of the provider's plate, if you will, because they're partners. There's a collaboration between the two. You tell me what the parameters are for this patient. I can monitor them, and then I can escalate them when they would normally, when they need care, right? So to your point, if the trends are curving in the wrong direction, there's intervention required, right? It just seems like there is a huge missed opportunity. What do you think hospitals need to hear? Because it's not as if there's not a lot of noise in the market, and maybe that's part of the problem in and of itself. What do you think the hospitals need to hear in context of why this is such a value-based opportunity for them?
Yeah. And I love that you attach it to value-based. So I think they got to take a step back and do the data analytics, right? Understand their patients, their who their patient population is, their utilization, and they got to take a step back. And I think when they see that data, I think it's going to tell a story. Everybody's data tells a story. And now that these pay for performance and these agreements are in place, I think showing them those opportunities, in mapping those out versus it's incentive versus they get penalties, right? And so
Yeah.
eliminating the penalties and now giving you in a way to make more money, and then of course that just makes it better for everybody. But I think they ultimately need to see it on paper, on an Excel spreadsheet, and I don't it's all for patient care. It's not because it's about dollars and cents, but it's because I think if you put it down in those columns and show them clearly, I think that might be one of the drivers to say, okay, this does make sense to have a strategy that maybe we just test our most complex elderly. Let's test 100 patients. They don't have to test a million. I think that's where it gets overwhelming, Tom.
Yeah, and I didn't mean to interrupt you there, but I absolutely agree. I think it's about crawling before you walk before you run. It's really the ability for to scale, right? Start small, gain success, and then grow, right? And then grow not leapfrog, just grow gradually into the programs. Maybe you just start with diabetes, then you start with respiratory care, then you start with X, Y, and Z chronic condition. Again, you don't have to build. Rome wasn't built in a day, so let's not reimagine. We can reimagine care in a day, but let's not realize it in a day, because you'll never get there, right? So let me ask you a separate question. We talk about value, and I talk a lot about the providers are incented based on value, but the patient probably has not a clue of how that incentive works. Meaning, so my father was a diabetic, obese, really never listened to his doctor. The point there being is, if at the time the provider was based on, it was being compensated, if you will, reimbursed based on value-based care, my father, he would have been fired, if you will, because he would have never achieved, he would have been the negative on the opportunity to improve glucose levels across this population, right? He was the drag, he was the cinder block, right? That was dragging the numbers down. So how does a hospital get a patient population on board with the idea of a value-based care model, and their responsibilities, if you will, towards improvement? Or I always talk about this awareness to wellness path, that a continuum that a patient needs to get on. If they're not on that path, the doctor's never going to get to his metrics in context of value-based.
I have done a lot of thinking about that because again, my own family and my mom has some similar ness with her wanting to do things a certain way and not wanting to change. And so I've done a lot of thinking around that. And I think that's the problem is that ultimately, if the patient's going to make these decisions, how do you make them make different decisions, understanding that there is tying into, this has a negative impact on their payers. And maybe it's just that conversation, because I don't think they know that. And, we often will do something for others more than we do for ourselves. So maybe it is that this is how you're impacting your physicians, your hospital, by at least not taking small steps, because they get negatively impacted. Maybe it's just more conversations, but most people don't know about this pay for performance or helping hospitals gain more revenue. They don't know that. But I also think it stems from the fact that patients just feel like hospitals have so much money. And I think that's also inaccurate thinking. They just don't know. So they just think, well, they can afford what, they don't need more money. Well, in fact, they operate on such thin margins, and some not at all. I think it's education.
And it sounds like there's born responsibility on the hospital system to promote wellness versus care. Well, I get that we're all in the care
Yeah.
business, but if we're not going to promote how to get to wellness and how to maintain wellness, I always say that if you have diabetes, if you develop type 2 diabetes, doesn't mean you have to die with it. And it doesn't mean that you just want to maintain your numbers.
Yeah.
I'm a big fan of the old TV show, The Biggest Loser, right? It's a classic model of very heavy, obese individuals who have potentially lost their way in the caring for themselves, and the awareness is raised about dieting, exercise, and a path to wellness, and suddenly they come off the show, and they walked onto the show with a bag of pills. They walk off the show with an empty hand, right? That's really the
Absolutely.
true essential. I know they did it in a TV episode, right? They did it in 3 months, but we can do that over a year or two with our patients so that they get rid of diabetes. They get rid of their chronic conditions. It is possible.
It is
Thoughts?
possible. Yeah, it is possible. And I give you one example. I had a friend of mine and her husband where he had diabetes and he ended up getting an infection in his foot and there was some other complications. But when they were being discharged, they said, okay, well, you need to change your diet. It's kind of on the discharge form, change your diet and go to the American Society of Dietitians or something. And they asked, like, can you give me a plan? They're like, oh, just go on the website. And I think you so accurately talk about there needs to be more tools around awareness versus they're being discharged. This is a serious, situation. And they asked the questions and they were told to go to a website. So, I agree that, we have to invest more in telling patients the things that they can do day to day. There, I talked to my mom and I said, Mom, let's just try to do a pound a month. Mom, in 12
Right.
months, you'll have lost 12 pounds. Just do a pound a month. And it's so attainable, like that it registers and she gets it. And she's like, well, I can do a pound a month. That's easy, Lisa. Okay, let's do it. Let's just walk a little bit. Let's count your
That's right.
calories, smaller portions. I don't want to make it so onerous on her that she doesn't, she's got a miserable life, but I can make it so that if little improvements over time is a big improvement.
I was listening to a discussion this morning, another program on Healthcare Now Radio, and the host was talking about, he was one that exercised. So the idea was getting someone to start the idea by doing one push-up a day.
Yeah.
What's one push-up a day going to do? Not very much, but one push-up leads to two leads to three, and then suddenly you're into it, if you will, right? So the idea, great one. Let's find a very easy milestone to achieve. 1 pound a month, maybe not so easy, but for some, I'm a wrestler, so I used to lose
Easy
that.
for you.
Keeping it off is the problem. But as I'm trying to do, but the point there being is, those are easy, obtainable goals, and I need a coach. My doctor is saying go to the website because I could easily forget. 50% of patients forget half of what their doctor says 1 hour after a patient visit, right? I can forget about what URL they told me to go to. There's many different reasons why I'm not going to get to that task because I'm so used to my own regiment that I'm just not. And so again, seeing your doctor 4 times a year doesn't help me in the idea of getting on that path to wellness because I just need that re-encouragement, and obesity in and of itself is a chronic condition. So it's not like there's no programs available to move that pendulum. A minute left. I'll give you the last word relative to 4 ways telehealth can improve hospital operations.
Yeah, I think the last word on it is this whole discussion was really the framework for what hospitals should do internally. Let's have discussions, right? I mean, and I think as you put people in a room and they're talking about their experiences, whether it's family or internally, and they start brainstorming and talking or just their, what they've learned, they can create their strategy. They can start making those shifts, I think, just by having those discussions, those what if discussions. And you made one point I just want to talk about as I wrap up, this idea around coaching. I don't know, you would know what that coverage would be, whether there's a CPT code, there might be, but is there a way that some of these patients could be coached? Or would a hospital invest? They invest in social determinants of health. Would they invest in some sort of weekly coaching? But we have to have these conversations, right?
Yeah, we definitely have to have these conversations. And I would say we can start with the 1 hour of billable time through remote patient monitoring.
Okay.
Right. That coach, that care coordinator coming on and just reinforcing, what's going on, how you doing, this is what you could do to improve your conditions, things of that nature. We could start there. Then you have chronic care management codes. And again, that remote therapeutic monitoring is going to also help with your meta compliance and things of that nature. So a lot more we could talk about. And I'm looking forward to that next conversation. Lisa, thank you so much for your time. It was very insightful. I hope our audience got a lot out of it and gives you a call for greater guidance as to how they can improve their hospital system. So again, thank you, and have a great day.
Thank you, Tom.
I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.